It's 2 a.m. You are driving home on a deserted highway. The world is quiet until your body screams. A sudden, crushing weight hits the center of your chest, like an elephant sitting on your rib cage. You gasp for air, but your lungs feel empty. You realize with terror you are having a heart attack, and you are all alone. Panic sets in. Your heart rate spikes, making the ischemia worse. What you do in the next 10 minutes determines if you survive. To survive, you first need to understand the enemy. Let's go inside. This is your coronary artery. For years, cholesterol and fat have built up here, forming a silent killer called plaque. Stress or high blood pressure caused this plaque to rupture. Your body thinks it's a wound, so it sends platelets to fix it. But in a narrow artery, this fix becomes a fatal blockade. Total occlusion. Blood flow to a part of your heart muscle is instantly cut off. The clock starts now. Back in the car, your body is sounding the alarm, but it's not just chest pain. Pain radiates. The nerves in your heart share pathways with your arm and jaw. Your brain gets confused about where the pain is coming from. You might feel a dull ache in your jaw, neck, or back. Many people ignore this, thinking it's just a muscle strain. Without oxygen, heart muscle cells begin to die within minutes. This is irreversible damage. Every second you wait, more tissue dies. You feel lightheaded as your blood pressure drops. You have the urge to pass out. Do not close your eyes. Fight it. Step 1 of survival. Stop all movement. Exertion demands oxygen that your heart cannot supply. Get into a half-sitting position, knees bent. This reduces the workload on the heart and keeps fluid out of your lungs. Aspirin. It is the single most important drug in this moment, but do not swallow it whole. Chew it. Chewing gets the medication into your bloodstream in 5 minutes versus 12 minutes if swallowed. That 7-minute difference can save your heart muscle. Inside your blood, the aspirin works as an antiplatelet agent. It makes your blood slippery, stopping the clot from getting bigger. It doesn't dissolve the clot, but it prevents total blockage. That tiny trickle of blood is keeping your heart tissue alive. Step 3. Call for help immediately. Put the phone on speaker and place it on your chest. Do not hang up. Even if you can't speak, the dispatcher can track your location. Say these exact words: heart attack, location is, and then stop talking to save energy. Critical tip: unlock your car doors. If you pass out, paramedics shouldn't have to break the glass to reach you. Now, let's address a dangerous internet rumor: cough CPR. You may have read that coughing rhythmically can squeeze the heart and keep you alive. In this scenario, that is wrong. Cough CPR is for cardiac arrest in a hospital setting with a doctor coaching you. Doing it alone during a heart attack raises your blood pressure and consumes precious oxygen. It can actually speed up cardiac arrest. Do not cough. Stay calm.
Your goal is to lower your heart rate. Panic releases adrenaline, which acts like fuel on the fire. Visualize the heart muscle relaxing. Activate your parasympathetic nervous system through slow, controlled exhalation. Help is coming, but suddenly you feel a wave of nausea and lightheadedness. This is the drop in blood pressure. If you feel you are going to faint, cough once hard to keep consciousness, then return to calm. The lights arrive. You made it to the next stage, the handover. Do not try to walk to the ambulance. Let them carry you. Walking now could be fatal. Oxygen is administered. It reduces the workload on your struggling heart. They hook you up. The ECG shows a STEMI, ST elevation myocardial infarction, a total blockage. You are bypassing the ER. You are going straight to the cath lab. Time is muscle. The gold standard treatment is angioplasty. Inside the cath lab, a team is ready. They don't cut your chest open. They go in through the wrist or groin. A thin guide wire is threaded all the way up to your heart. Contrast dye reveals the blockade. There it is, the widowmaker. The cardiologist threads a balloon catheter through the clot. Inflation. The balloon crushes the plaque against the artery wall, opening the channel. A metal stent is left behind. It acts like a scaffold to keep the artery open forever. Reperfusion. Blood rushes back into the starving muscle. The pain vanishes instantly. You survived, but your heart has changed. The part that died is now scar tissue. Scar tissue doesn't pump. Your heart is weaker, but it is still beating. This was your wake-up call. The next one might not be survivable. Know your risks: smoking, hypertension, cholesterol, and stress. Keep your blood pressure low. High pressure causes the plaque to rupture in the first place. Preparation. Keep baby aspirin in your car, your wallet, and your nightstand. If you feel that crushing weight, don't wait to see if it passes. It won't. Recall the protocol. Stop, chew aspirin, call 911, unlock the door, sit and wait. Your life is fragile, but with the right knowledge, you can be your own first responder. Share this video with someone you love. It might save them one day. I am the medic stick.
Making medicine simple. Making survival possible.
Emergency services. What is the address of the emergency?
I need help. We're on the highway, just past the exit. Please hurry.